Not sure how many times you have unplugged the iron in your life and returned home? Or how many times have you been late for your appointments because you are not sure whether you have turned the stove off? Did I turn off the TV? Did I turn off the lamp? Did I close the window? If you are faced with these and similar situations in daily life, I should be sorry to state that, unfortunately, you are obsessed. You don't have to be scared right away. Because under these conditions, we can say that there are 50 million obsessed people in our country. In fact, it is obvious that obsession, with its name in the literature, is obsession. The real problem is starting compulsion. In other words, if you have any question marks in your mind about whether I pulled the iron after leaving the house, we have compulsion. If we cannot suppress our obsession and come back halfway and check it, we have a compulsion. If this compulsion significantly affects our quality of life and makes life uninhabitable, we call it the obsessive-compulsive disorder (OCD) disease, which is definitely a condition that needs to be treated. Primary treatment of OCD disease: the course of the disease is positively affected by the use of high-dose antidepressants and subsequently supported by cognitive behavioral psychotherapy. However, after this 30-week treatment period, different treatment methods can be applied, one of which is CyberKnife Radiosurgery treatment named anterior capsulotomy. It is an additional option for OCD patients when there is no response from medication and psychotherapy. It is thought that there is a circle from the front of the brain to the central nuclei and from the front to the front again. In these patients, an increase of methobalism is observed in the frontal lobes, compared to normal individuals. One of the places where this passes is the structure of the brain called the internal capsule. Small damage of 5 miles is done. 2. Patients are given a special mask so that they do not move their heads during the application. In this way, patient movement is limited. Unlike tumor treatment, very high radiation is given to the area, because the incision in the nerve pathways is desired. But this incision is made with radiation, not with a knife. 3. This process is radiation oncology specialist, neurosurgery and medical physicist. The neurosurgeon specialist, together with the radiation oncology specialist, determines the target area and the dose of radiation to be applied, while the medical physicist gives the required dose to the targeted area by making the necessary calculations, while planning to preserve the healthy brain tissue in the best way. Finally, plasma treatment is approved and applied to the patient by radiosurgery technician. The linear accelerator connected to the robotic arm during the treatment, lasting approximately 2 hours, moves around the patient and delivers the desired dose to the target area from more than 100 different points as planned. In this process, which is applied without any anesthesia to the patient does not feel the slightest pain or pain. It is necessary to wait 3 to 6 months for the treatment results.